I'm Representative Marcia Hovey-Wright. I'm the chair of the Women's Caucus, and I'm here today to talk to you about something that is vitally important to me, my health. I don't just mean my own health. I mean that of Senator Rebecca Warren and Marcia Levine, a Michigan State University student who is joining us at the podium today. I'm talking about the health and safety of all women. Things such as an annual well woman exam, cancer screenings, contraceptive care should be considered components of basic health care. In fact, until very recently, we all assumed they were. But lately, overzealous Republicans nationwide have sought to make the health of myself and all other women a political football. They want to use our health in a way to score points. In doing so, they have tried to cut off funding to Planned Parenthood, the largest organization in the nation that provides low-cost cancer screening to women with limited income. They have tried to pass laws demanding that women receive unnecessary and invasive transvaginal probe ultrasounds if they need to end a pregnancy. Currently, Republicans in the U.S. Senate are wondering whether they should reauthorize Violence Against Women Act, the measure that has funded women's anti-domestic violence programs in Michigan and around the country since 1994. Here in Michigan, the House of Representatives recently pushed through a measure that would make it illegal to force a woman to have an abortion, but refused to allow an amendment that would also criminalize forcing a woman to carry a pregnancy to term against her will. There are bills pending in Michigan that would also require unnecessary ultrasounds for women choosing to end a pregnancy. In fact, Republicans in Michigan work hand in hand with groups that have extreme agendas and push for laws that restrict women's health care. Republicans insist that they are not waging a war against women, but women increasingly feel that we are under attack. And the shame of it is, there's a lot of common ground that we share. Instead of fighting against things like breast cancer and cervical cancer, these measures offered by Republicans instead pit us against each other. Rather than fighting unplanned pregnancies, we are fighting each other over restrictions on abortion. And it doesn't have to be this way. We can and we should work together to prevent unplanned pregnancy. And in so doing, we will reduce the need for abortion, a goal I think we can all agree on. We can and we should be working together to improve access to cancer screening, and this will lead to early detection of cervical cancer, which in turn leads to improved outcomes and lower healthcare expenses. We should be working together to educate women about their options so they can make well-informed decisions about their health and their family planning. We are here today to take the first step in that direction. The Prevention First campaign is a package of bills proposed legislation that would expand access to basic family planning and women's health services. The measures include requiring private healthcare plans to include the same level of coverage for contraceptives and other forms of medication, and ensure pharmacies have a duty to dispense Food and Drug Administrative approved medications. The proposals include measures to require insurance plans to cover annual Pap tests and require comprehensive sex education to be available in all Michigan schools.